Hello, my name is Audrey Duncan. Today I will be discussing the effects of different medication types on patients with schizophrenia. The PICO question I've chosen to explore is, in patients receiving care for schizophrenia, how do long-acting antipsychotic injections, as compared to oral antipsychotics, affect medication compliance? This topic is important because the prevalence of non-adherence to medication in this population is high. One study estimated that up to 60% of patients discontinued their medications after 2 to 3 months of beginning the regimen, and 80% after 2 years of beginning the regimen, and this is cited. Another reason is increasing medication compliance in patients with schizophrenia decreases overall cost of care by decreasing hospitalizations and ER visits. Lastly, increasing medication compliance affects the quality of life of patients with schizophrenia. I chose this area of interest specifically because I work with adult behavioral health patients in an inpatient setting, and medication adherence is an issue I see often. Major findings in the literature. The first article critiqued was by Keenan and others. In this article, kappa analysis was utilized to calculate level of agreement between psychiatrists and patients. Severity of illness was equal to 0.174, and level of improvement on treatment was equal to 0.204. These findings mean that oftentimes psychiatrists perceive their patients' severity of illness as less severe than what their patients perceive their severity of illness to be, and that psychiatrists see their patients' level of improvement as greater than what their patients perceive their level of improvement to be. The major finding in Article 2 by Joshi and others includes patients receiving palperidone palmitate were more adherent on the index antipsychotic than those receiving oral atypical antipsychotics. The major finding in Article 3 by Blackwood and others is patients who preferred long-acting injections regarded patient empowerment and quality of life as most important. This gives insight as to why patients may prefer long-acting antipsychotics as opposed to oral antipsychotics. Major findings in the literature continued. The major finding in Article 4 by Fang and others included patients on long-acting injections were less likely to experience psychiatric hospitalization, and ER visits were lower in patients receiving long-acting injections as compared to oral antipsychotics. Article 5 by El Said and Said found that patients on long-acting injections were more adherent to medication than patients on oral antipsychotics. Gaps in literature. The lack of power of analysis in the articles was one gap seen in the literature. Another gap seen was the lack of proof of reliability and validity. The validity of the article by Keenan and others was stated to not be possible to measure, and therefore this article was deemed most unreliable. The article by Fang and others did compare comorbidities, but there were other articles that did not compare comorbidities for the patients. The article by El Said and Said utilized a small sample size, so the findings in this study may not be able to predict outcomes for the entire psychiatric population. Research needs and next steps. Lack of literature regarding the research topic. Finding literature regarding this research topic was an obstacle due to the literature scarcity. Result causation. Most literature states that long-acting injections improve patient compliance to antipsychotic therapy, but the reason that this is true could be investigated more thoroughly. Patient preference, financial influences, availability, patient education, and understanding are just some topics that could be researched to give insight to the results. Provider interviews. Provider interviews could be conducted more in research. Research should investigate provider prescribing preferences and their views on the different medication types for patients with schizophrenia. Patient history. Some patients may have been unsuccessful at being adherent to oral antipsychotics for years and then become adherent to a long-acting injection. Some patients may begin a long-acting injection as a first line of therapy. This information will be beneficial in comparing long-acting injections and oral antipsychotics. In regards to the future, more studies in depth should be conducted in regards to the research topic. References listed. References continued.